Hi! Over the next few weeks, we are going to walk you through what it means to do IVF.
Yeah, and this week specifically talking about IVF stimulation.
Yeah. So if this is your first time meeting us, I'm Sarah. I am a board certified OBGYN and infertility doctor, as well as going through IVF myself right now.
Yep. And I'm Kurt. I'm a board certified pediatrician and expert IVF med shot giver.
Indeed. And we are
the Doctors Bjorkman.
Some of you may know someone who did IVF, or you have a friend who's going through it, or maybe you don't know what to expect at all, and that is okay.
Yeah, we are going to explain all the steps over the next few weeks as we experience it ourselves, so you can know exactly what to expect too.
Yeah. In our Infertility Basics video, we talked about that initial visit, some tests that might be done, as well as some causes of infertility. So be sure to check that video out too.
So maybe you could start by saying, what actually happens? How do you start IVF?
Okay. Usually it starts with 2 or 3 weeks of birth control pills.
That seems kind of counterintuitive.
It does. I know some protocols use other things like Lupron or estrogen pills, but frequently birth control pills are used for 2 reasons. So one is to help time your cycle, and then number 2 is to make sure that you have a synchronized cohort of follicles, meaning you want the ovary to be quiet when you start. You don't want one of those follicles to be bigger or ahead of the rest when you get started. When you're doing IVF, basically your doctor wants to take over what the brain normally does in a regular cycle.
Gotcha. Okay, so you're on oral contraceptives or birth control pills, right. Then what?
Well, a day or 2 after you stop your birth control pills, you may get a little bit of a withdrawal bleed. It is around that time that you go in for a baseline ultrasound and some blood work. This is to make sure the lining of your uterus is nice and thin and we don't see any polyps or fibroids or anything else unexpected. And we also at that time are taking a look at your ovaries to make sure, again, they're nice and quiet. We don't want any big follicles or cysts.
Gotcha. Now, and then the blood work at this time, they're usually checking things like estrogen and may also check some other hormones, things like progesterone or luteinizing hormone, LH.
Correct. So after you get the green light that your baseline scan looks good, it is time to start those injectable medications.
Yeah, and so we actually have a whole video coming out, I think next week, on how to give all of these IVF meds, including actual video of us giving injections, Sarah giving injections to herself, and me giving some of those injections to her as well, to kind of be as a refresher to help you feel comfortable kind of giving yourself an injection at home, or if you're a partner, giving those for your partner as well.
Yes. Once you start the gonadotropins or that stimulation medication, that kind of begins the process of coming in every other day for ultrasounds and some blood work.
Yeah. So what are gonadotropins?
Gonadotropins are the injectable medications that you're taking during your stimulation. So that is FSH and LH. So Follistim, Gonal-F, Menopur, etc. And these are just like the hormones that your brain makes every month to stimulate your ovary to make an egg. We are just giving them to you in much higher doses because we are hoping for as many eggs as we can safely get.
Yeah. And so you're taking these meds, how long does this take?
Well, it kind of depends on how your ovaries respond. You usually come in for transvaginal ultrasound and the blood work every other day. The ultrasound tech measures all of your follicles each time, and we're using that follicle size plus the blood work to help us determine when your eggs are mature and ready to go. Generally, it is 8 to 12 days of those injectable medications before you're ready.
Gotcha. And so once the eggs are mature, so this means they're usually getting close to that 18 to 19 millimeters in diameter mark, that's when it's time for your trigger shot.
Yes, the trigger shot. Usually Lupron or HCG or both signals the final maturation of those eggs. 36 hours after the trigger shot, your doc will go and get all of those eggs at your retrieval. It is really important to take your trigger shot correctly and at the exact time that your doc tells you to. This is because we know that your body will be ready to ovulate 36 hours after that trigger shot. But of course, we don't actually want you to ovulate. We want to go and get the eggs ourselves. So retrievals are generally scheduled for 35 to 36 hours after the trigger.
Gotcha. And I assume if you give the shot too early, then there's a risk you might actually ovulate before they can harvest them.
Right.
Or if you give it too late, then there's a chance that they aren't quite ready to be harvested at the time of your appointment.
Correct.
How do patients feel during all of this?
Well, that really varies from person to person. The side effects from these medications can include burning and redness at the injection site. You can some patients experience a lot of bloating or headaches and stomach pain, some breast tenderness, plus, compounded with all the emotions of going through infertility, and this whole IVF process is somewhat unpredictable. You don't have a lot of control over it, and it can just be a lot for patients.
Are there any big consequences or potential medical issues? What about OHSS? What's that?
So great thing to think about. One of the risks of doing IVF and IVF stimulation is something called OHSS, or ovarian hyperstimulation syndrome. It is one, again, of the few complications that can happen during an IVF stimulation. It is usually seen in patients who have a high ovarian reserve and are younger, but we keep our eye on everyone as they are going through their cycle. So OHSS is when the ovaries kind of go into hyperdrive because of these medications that we are giving you. We want your ovaries to hyper respond, but sometimes they go into overdrive, they start pulling fluid into your pelvis. And so you can get a lot of fluid in your abdomen, you can get fluid in your lungs, you are at higher risk for blood clots. And it can be really very dangerous. It's also very rare because of newer, very safe protocols. It develops in less than 1% of patients, but if you develop severe bloating, nausea, rapid weight gain, you aren't peeing as frequently as you normally do, and you start feeling short of breath, these are all reasons to call your clinic right away.
So as you're going through, how can the partner best be involved? What should they be doing?
Well, if your clinic allows, hopefully your partner can go with you for some of those follicle tracking scans. Most patients do feel pretty comfortable giving themselves the stimulation meds, those gonadotropins, but some may not, and you may need to help physically give a shot. If not giving a shot, it's really nice when they get the meds ready or get the injections drawn up or just set everything out, because it's kind of a process which you'll see in the med video next week.
Yeah, and I think from the partner standpoint, it's good to just check in and see how your partner is handling everything that's going on emotionally.
Right.
There's just a lot that's happening in terms of we've now taken something that was very not medical and making it medical, and something that was very much required to people, and kind of removing some of that two-person interaction. And so it's just good as a partner, check in on your person. It's also something that you've really waited for a long time maybe, and then all of a sudden everything's happening all at once. There's appointments every other day, injections in the morning and night, and it can just be a lot.
It's a lot. Also, we're thinking about the partner helping. Usually the daily gonadotropin injections are okay and patients do themselves, but the trigger shot is usually a much bigger needle, so your partner is likely going to be needed for that one. So, IVF was not something we anticipated doing, but here we are. It's been going fine, as you can see from some of the other clips of going in for scans and different things. The injections are not as bad as I thought. I remember when, as you all may have seen, giving myself that first shot, I was like, oh, this isn't that bad. And I remember going into work the next day and telling our pharmacist, like, oh, I didn't even feel it. And she said, well, yeah, it's kind of like injecting a hot dog. And I thought that was rude, but it was not incorrect. It was uneventful for you.
Yeah, actually, it's surprisingly uneventful for the partner. I think it's funny in terms of, you know, generally, like, having a baby is very much a team sport, and this, like, is something that, like, I could have not been around for any of the Stim part, and, like, it would have just happened. So I think it's just a good reminder as the partner to, like, check in with your person, because even though, like, I really haven't been needed to this point, like, it's still, we are still a team, and making sure there's, like, still emotions, still things, like, we are trying to grow our family, and so, like, wanting to just be there and be supportive emotionally, even if there isn't physically a whole lot that I have to do or can do.
Because it's all just kind of a pain, right?
Yeah.
You have to go to these appointments every day, and so you've got to miss work or go late to work or do these different things, and you have to take a shot at the same time in the morning and the same time at night, and it's all just kind of a pain. Like, you got to get the needle out, you need to get your alcohol swab out, you have to mix up the injection, you have to draw up the other injection. It's just a process, and it gets old. You get really good at it, but it's just a lot. It is not the old-fashioned way of making a baby by any means. And so
Significantly less fun.
it's way less fun, which we've said multiple times so far. So that's how Stim is going. We will keep you updated on retrieval, transfer, and all the things.
And we will see you guys next week.
Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.